Hello, and welcome back to Dr. Carri's Clinical Corner. Today we're going to talk about going to the bathroom, getting up in the night to go to the bathroom. So there's a name for this. It's called nocturia, like basically nocturnal and urine kind of together, nocturia. And so this just means getting up at night to go to the bathroom. So what's considered normal? First of all, it's considered normal for a majority of people to sleep through the night and not wake up and have to go to the bathroom. If you're over the age 65, it's considered normal to get up once in the night to go to the bathroom. If you're pregnant, also you're probably going to get up in the night to go to the bathroom. Also, I see a lot of people in the clinic who are newly postpartum and maybe they're breastfeeding or they have a small baby who's up every few hours. It's normal if you're awake to go to the bathroom when you're awake. Don't stress about that. This is sort of like a temporary time in life, is the newborn phase and everything's off. But a lot of times people come to me in the clinic and they're like, my main complaint is I get up all the time at night to go to the bathroom. So there's a couple things with this. Number one, in the clinic, if I see people, I'll check their pelvic floor, right? Like make sure there's no tightness, weakness, endurance issues, things like that. We'll work on that. Number two, we also work on daytime bladder habits. So if you watched my other bladder videos, I created this online course to really work on people's bladder habits and optimize those. So I'll link below the free introductory class. So sign up for that, take it, check it out, try it. But then I made this comprehensive bladder course to sort of help people with their overall bladder habits. And in that course, I do talk about getting up at night a lot. But what I tell people is, let's optimize your bladder habits during the day. How you're drinking, how often you're going to the bathroom, how much you're peeing, how often you're peeing during the day. Because ultimately, as a physical therapist, even when I did like orthopedic stuff, people would ask like, should I sleep in a certain position? And like, my belief is let's fix the things during the day that we can and not mess with your sleep, because I don't ultimately think what we do when we're sleeping contributes that much to our pain. Maybe sometimes, but we have a lot more control over what we do during the day. And if we're trying to think about like, I want to sleep in a certain position, like we're not going to get as good of quality of sleep. So yeah, when you're getting up a lot at night to go to the bathroom, you're not getting as good of quality of sleep. And that can make everything else worse, right? Like if you're not sleeping, if you're sleep deprived, everything else in life feels just worse. So we want to fix this. And so those are kind of like where I start. Like, let's check out your pelvic floor if you're coming in the clinic, make sure all of that's good. I tell people like, see the urologist, get the urology test to make sure. Let's optimize your daytime bladder habits. If you're a male and you have a prostate, get your prostate checked. A lot of times what happens with males as they get older, the prostate gets bigger. So in males, the bladder sits on top of the prostate. In females, it's the opposite. The uterus sits on top of the bladder. That's why females often have more bladder issues. But if you're a male, this is your bladder, this is your prostate. If the prostate's getting bigger, there's less space for the bladder and it's always kind of putting pressure on the bladder. So it makes you feel like you have to go more often. So you want to make sure if you're a male, you don't have prostate cancer. That's super huge. Prostate cancer is very, very curable if you get it early. But if you don't get it early, less curable. But it's like 95% of people live beyond 5 years. 5 years is kind of like the marker for cancer. If you catch it early, it's super common in males over the age of like 70. It just is, I don't know, anatomy, biology, that's just the way it is. Aging body parts, but it's very, very treatable, curable. So if you're a male and this is your issue, get your prostate checked, get your PSA level checked, see a urologist. There are medicines for overactive bladder. I see in my patients, some of them it helps, some of them they don't. The side effect is usually constipation. Then you gotta take stool softeners. Every medication is like that, right? Like everything has a side effect, then you gotta take something else. It has a side effect. So we're trying to treat things without medication and surgery. That's basically what I'm doing in pelvic floor therapy. The third thing I would say for nocturia, getting up at night to go to the bathroom, is if you've done all these things, if you've had your pelvic floor checked, if you've worked on your daytime bladder habits, if you're a male and you've had your prostate checked, then the other thing that we commonly think it is a form of sleep apnea. So sleep apnea is basically during your sleep, in maybe certain positions or whatever, you're not getting enough oxygen, and so your body wakes up. Your brain and your body is very smart. Like, oxygen is a primal need, and so it's like the primal part of your brain. So oftentimes what we think is happening, if we've fixed everything else and you're still waking up a lot at night to go to the bathroom, is it's a sleep apnea problem. It's actually not a pelvic floor or bladder problem, because we think what's happening is you're not getting enough oxygen, your body's waking up, you're awake, you think, I need to go to the bathroom, you go to the bathroom, right? And this becomes a habit. I'm not saying it's a bad thing. I think it's very normal and natural. Like, I'm awake, let me go to the bathroom. We think that's why we woke up, but we actually maybe woke up because we weren't getting enough oxygen. So I have my patients in the clinic, if we've done all the pelvic floor therapy things, we've checked out the pelvic floor, we've optimized like strength, endurance, coordination, we've optimized bladder habits during the day, I encourage them, go see your doctor, try to get a sleep apnea test and see if that's the issue. Again, I think kind of what I've learned over the years is sleep apnea is probably more common than we think. I don't really buy into the like taping your mouth, taping your nose, whatever people are doing to breathe. That's not the cure. I don't really think there's a lot of science behind that. But yeah, you need oxygen. So sort of what we were taught in physical therapy school is it's like mostly obesity, right? And then like they can't, the weight sort of limits their oxygen, especially if they're sleeping on their back. But kind of what I've learned over the years from some dentists that work on sleep apnea, it's more like your airway, and some of that is just genetic, what you're born with. Some dentists believe it's like, even as an adult, maybe you get your tonsils and adenoids removed. Sometimes, so often we think sleep apnea, we need the CPAP machine, and maybe, but sometimes, dentists who are trained in this, they can create sort of a retainer or a nighttime sleep device for your mouth. So some of the signs of that is like, are you snoring? Are you always tired? Do you fall asleep easily during the day? Those are some other signs of sleep apnea. So not that everyone that snores has sleep apnea, but often that's like a common sign of it. So sort of that's pelvic floor therapy. We got to think about the whole person and the whole body. It's not just about Kegels, and that's what I love about it. So if you're waking up a lot at night, go through those things. See a pelvic floor therapist, see a urologist to get the like normal urology test to make sure your bladder's empty and it's filling, like all the things. If you're a male, get your prostate checked, get your PSA checked, get your prostate checked, and work on your daily bladder habits, and if nothing else, get a sleep apnea test. All right, here's to better sleep. It's so important, and I'll see you next time.